These are the features of Xeon Medical's catheter, the XemeX IAB Balloon Plus, and instructions on how to use it. Product features. The XemeX IAB Balloon Plus catheter is made from a special material that is less affected by the blood heat and boasts high stiffness of the catheter. The unique design offers excellent stability of the catheter and balloon positioning. The high-quality sheath introducer permits smooth acquirement of approach vessel and facilitates ideal IABP procedures. The characteristic short balloon incorporates XemeX superior technology. It allows the balloon to be placed appropriately, reduces the risk of complications, and results in an even higher IABP effect. Operation. Let's look at how to use it. These are the components included with the product. Driving tube for datascope console. Driving tube for arrow console. Balloon tray. Introducer tray. Remove the package by pulling at the peel-off sticker. Contents of introducer tray. Puncture needle. Dilator for sheathless insertion. Dilator for sheath. Sheath. Here is how to set up the sheath introducer. Guide wire for sheath. Guide wire for balloon. Extension line. Three-way stopcock. Here is how to connect the extension line and three-way stopcock. Contents of balloon tray. One-way valve for balloon decompression. 50 milliliter lure lock syringe. Catheter. Preparation before insertion. This is the preparation procedure before insertion. Connect the one-way valve for balloon decompression to a short tube. Connect the one-way valve to the lure lock syringe. Use the syringe to apply negative pressure. Remove the syringe. From the tray, remove the balloon catheter with the one-way valve attached. Next, Remove the balloon covers using the following procedure. First, pull out the stylet, which prevents kinks, from the tip of the balloon catheter. Slowly draw out the balloon covers one by one from the tip. The 7 French type has 3 balloon covers, and the 8 French type has 2 covers. Be sure to do this with the one-way valve connected. Otherwise, the balloon covers will be possibly difficult to be removed, or the balloon may loosen coiling, making it difficult to be inserted. Be sure to sufficiently apply negative pressure of balloon. Otherwise, the balloon may loosen coiling, making it difficult to be inserted. After the balloon catheter is inserted, after inserting the balloon catheter, remove the one-way valve from the short tube. Connect the short tube to the driving tube and prepare for driving. Follow the IABP driving operation, referring to the operation manual of IABP driving console. During IABP driving, observe the blood pressure waveform on the monitor of the placement unit and adjust the timing of the balloon inflation and deflation to optimize the IABP blood pressure assistance. A hemoplug and sheath should be secured in this manner. How to use the dilator for sheathless insertion. The dilator is used only for sheathless insertion. Use the dilator together with the included guide wire for the balloon. The included guide wire for the sheath cannot be inserted into the dilator. Precautions to avoid uncoiling the product. We take all possible measures during manufacturing to ensure the quality of the product. But if the balloon is uncoiled before it is inserted, do not use product. Please retain the catheter, packaging, and all included items and return them to us. In the case of uncoiling, if console alarm sounds at the start of pumping and pumping does not get started, manually unwrap the balloon following the procedure below. Connect a lure lock syringe to a short tube. Use the syringe to create negative pressure. Check for blood flowing into the syringe. If blood is flowing in, immediately discontinue use of the product, withdraw the catheter, and replace it with a new one. Using a lure lock syringe with a capacity of around 50 milliliters, slowly inject 30 to 40 milliliters of carbon dioxide or helium gas to apply pressure. Do not inject more than 60 milliliters of gas. After using an X-ray fluoroscope to confirm that the balloon is properly dilated, remove the lure lock syringe and connect a driving tube to start pumping. If the catheter does not get completely unwrapped, discontinue use of the product and replace the balloon catheter with a new one. Be sure to conduct the unwrapping operation under an X-ray fluoroscope. The edge of the proximal part of each balloon contains radiopaque markers that are visible under an X-ray fluoroscope, which allows the proximal and distal parts of a balloon to be observed fluoroscopically. When the unwrapping process is not smooth and full balloon inflation is not obtained, the following factors may be considered. Stop using the device and take an appropriate course of action. One, full inflation of a balloon cannot be obtained due to severe tortuousness of the vessel, or the balloon capacity is too big for the patient's vessel diameter. 2. It may have been entered into a false cavity of an aortic aneurysm. 3. The wrapping of the balloon may be too tight, and the balloon cannot be unwrapped. 4. The setting capacity of the driving console is too low. 5. The balloon inflation-deflation may not follow when aorta internal pressure is considerably high or at the time of tachycardia. Withdrawal procedure. Remove the driving tube from the catheter and connect a one-way decompression valve with a short tube. Decompress the balloon catheter once with a 50 milliliter Luer lock syringe. When a one-way valve is not available, use a three-way stopcock as follows. With the one-way valve for decompression still connected to the balloon catheter, pull the catheter until the proximal part of the balloon hits the tip of the sheath. Hold the sheath with your left hand so that the sheath cannot come off, and pull the catheter with your right hand while holding a part close to the sheath. Once the proximal part of the balloon reaches the tip of the sheath, pull out both the sheath and the catheter. When part of the balloon is observed coming out from patient's skin, grasp the balloon part and pull until the balloon is fully extracted. If the balloon catheter can be withdrawn only under decompression by the driving console, the balloon may not be fully deflated, and you may feel withdrawal resistance, possibly making withdrawal difficult. Please note that the balloon catheter and the sheath must be withdrawn together. If you try to withdraw the catheter through the sheath, the balloon and the catheter may be split off at its junction, leaving the balloon in the blood vessel. Do not force the balloon into the sheath. The balloon membrane may be caught by the tip of the sheath, making withdrawal difficult. Recommended balloon volumes for different patient heights. The IABP balloon volume is set according to the patient's height. For a 7 French catheter, the following combinations of patient height and balloon length, diameter, and volume are recommended. These are for an 8 French catheter. The values are only recommendation, so in actual use, please find an optimum combination by checking the length and the diameter of a balloon. The product is intended to be used in an appropriate institution by skillful doctors who thoroughly understand how to use it. In using the product, please make sure to refer to the accompanying documents and follow the instructions.